Welcome back to Season 3. This season we'll be looking at a new aspect of sustainability, the healthcare sector. And so, our season title is A Manifesto for Surgical Health in Africa. I have invited Professor Bruce Bickard to host this season, the first time Earthcast will be hosted by someone other than myself. Bruce will unpack his new book through interviews with African and global experts in the field who helped him write it.
Right, good afternoon everyone. It's my pleasure to introduce the 6th episode in the series, and through the series of podcasts we've discussed the state of surgery and anesthesia in Africa and potential strategies on how we may improve health outcomes in Africa. In the previous episode we focused on advocacy for safer surgery in Africa. In this podcast we will discuss the last part of the book, which focuses on health strengthening, a manifesto for safe surgery, and the principles on how to get people involved in activities to improve surgical care in Africa. Our two guests today, like the previous guests, also feature in the book. It's my pleasure to welcome Salome Maswime, who is Professor and Head of Global Surgery Division at the University of Cape Town. She is an obstetrician and gynaecologist. She is the Vice President of the Women in Global Health South Africa. She is a founder and president of the South African Clinician Scientist Society and chairperson of the Health Systems Trust. Hi, Salome.
Hi, thank you very much.
Well, it's such a pleasure to have you. Thank you. And then I'd like to introduce Tinashe Chandauka, who is founder and chief executive officer of Nandi Life Sciences. He is an entrepreneur in residence at Texas Medical Center Innovations Accelerating Cancer Therapeutics, or ACT. He holds a PhD or doctorate from Oxford University, where he was a Rhodes Scholar, and a medical degree from my alma mater, the University of Cape Town. He holds medical licenses in the UK and South Africa, and he is a member of the board of directors of AMREF, a global Africa-focused healthcare charity. So welcome, Tinashe.
Thank you, Bruce. Thank you, Salome. Really great to be speaking to you guys.
Yes, it's exciting. You two have been core to this part of the book, and thank you. I'm going to start, as I always do, with a little reading from the book. And this is really follows a description of Salome's early career, where she worked in a small hospital in KwaZulu-Natal, South Africa. In fact, a hospital that I was supposed to go and do a locum at, but was too scared because I didn't have the skills. But she went there in her community service, and she managed the labor ward. And in the book, she describes 2 deaths which happened, which obviously affected her tremendously. So I'm picking it up from there. The following year, Salome moved from that small hospital in rural KwaZulu-Natal to the biggest hospital in Africa, Baragwanath, to train in obstetrics and gynecology. She moved quickly through the ranks, and by 2014, with training complete, Salome embarked on her doctorate on caesarean section hemorrhage. When we spoke for the first time, she was in the thick of it, reviewing the patient's files of obstetric hemorrhage from 15 South African hospitals, and felt that she was reliving the distress of the labor ward of a community service. Even though she now had the clinical skills to manage the devastation that she saw as an obstetrician, she still felt disempowered, as she could see that her early experiences of maternal deaths were playing out in hospitals all over South Africa. Salome, this is when you said to me, once you've seen it, you cannot unsee it. And by the it for the listener, what Salome is referring to is that unacceptable morbidity and mortality associated with surgery across Africa. So Salome, firstly to you. From the time we started working together, you have driven for health system strengthening to ensure safe surgery and anesthesia. Could you explain to the listeners this concept of health system strengthening and why it's so important in Africa? Then it would help to understand your personal experiences that led you to this insight for the need for health system strengthening in Africa.
Thank you very much, Bruce. And yeah, completely. You've just taken me back to what felt like a really emotional time of my life, thinking that all I had to be was a good doctor, and that if you're competent and confident, then your patients are going to be safe. But through the PhD and through my personal experiences, it was very clear to me that there was a lot more going on behind the scenes that I had no control over. Many of us work in hospitals. We don't really know who's ordering the drugs, who's getting the fluids, etc., etc. And so there are systems issues. There's health systems that are being organized even within that space, but also from a political side as well, that who decides which diseases are going to be prioritized, how the resources are going to be split between provinces, between cities, between hospitals. There's a lot of decisions that are being made about how healthcare is going to be delivered that often frontliners are not even aware of. But when things go wrong, you obviously feel like it's partly your fault, and it's not easy to recognize that there's a system in which we work which will determine whether our outcomes are good or bad. So having done this work for quite a bit, I think our biggest task was to determine what does global surgery mean for us as Africans in Africa who are not traveling elsewhere to provide care. What can we do to strengthen our surgical system? And so coming to this work as an obstetrician, not as a public health specialist, I had to first understand a very important public health concepts to do this work, but also to understand public policy, administration, leadership, how are decisions made, how's healthcare financed, what investments go into healthcare. And so we have eventually developed a framework which we call Global Surgery in Action. And that's really about what can you do to strengthen the health system. The areas that we've identified as health system strengthening areas is one, surgical prevention, which would be working with communities on preventing and reducing the unmet need for surgical care. And you have to think outside of the hospital, outside of the theater to see this work, that it's not just about treating the patients that come in, but if trauma is high or accidents and injuries are high, what is the reason why it's so high in this place, and what can be done to prevent mortality or reduce mortality or the need for surgery from this. But at facility level, it's things like capacity building, the training of surgeons, the training of medical officers on how to provide safer surgery, safe anesthesia, safe obstetric services, and then quality improvement. And that again is the behind the scenes work on, how do we reduce the interval between decision to do surgery to the incision in the surgical theater, or how do we get better outcomes and safer surgery. But the other part that many of us as clinicians often are not aware of is policy engagement, as well as surgical leadership. And these are kind of the two areas that I've learned and that I've been working on, particularly in the past few years, where it's not enough simply to learn how to provide a service. Healthcare is very political, and some policies are going to enable better health outcomes and some are not. And so we need to be quite aware of the policies that exist across different healthcare systems, because the surgery, a cesarean section, is pretty much the same wherever you do it in any part of the world. But the policies across different health systems are different, and we need to understand that so that we make better decisions that will ultimately involve investment, finances, and resources. But we developed a course called the Executive Leadership Course in Global Surgery, and that's on surgical leadership. And so we felt one intervention is bringing in the decision makers. These could be senior surgeons who are senior clinicians making decisions on how resources are distributed across the hospital, but it can also be policymakers and senior decision makers at Department of Health level, and starting to frame how they think about surgical care and what decisions they can make about the resources and distribution of resources in their settings could ultimately lead to strengthening the health system.
I think, Salome, it's a great introduction, massive ground you covered in such a short period of time. But I think it's a nice segue to move to Tinashe, and then we'll come back actually to policy, because I want to ask you more about that with dealing with governments across Africa. So I just firstly want to now go to Tinashe. Tinashe, you challenged me when we were discussing this book that I need to present a manifesto for safe surgery and anesthesia, almost as a challenge to the reader, and I must thank you for this. So I just want to, again, just read a tiny bit about this, my experience from the book, which goes like this. This has made me reflect critically on what I now understand about the intersection between health and surgery and society. Also helped me to understand how a declaration of intentions is framed by a position, either as an individual, a community, a profession, a group, a political party, government, country, or region. So in writing this manifesto, it's necessary to position declarations which extend beyond that of the individual to group declarations of various communities and governments. And I think what I'm trying to say is, if we can honor our place in these declarations, each of us in our own small way may be able to contribute to a massive health system strengthening in Africa and drive for safe anesthesia and surgery. So, I think maybe people listening to these podcasts might have thrown their arms up in the air thinking, wow, such a big job to do. But the reality, I think, which comes from the manifesto that you drove and the challenges is, and also the scope of work which Salome's described, means that there's an opportunity for almost everyone to contribute in some small way to making surgery safer in Africa. And I think for you, Tinashe, I'm just interested to know how we can leverage this message to the global community.
Thanks for the opportunity, Bruce. It's actually really interesting that you asked me that question as I'm sitting in Boston this morning for a set of meetings along these kind of issues. Just to frame a little bit of my positionality on the issue, obviously I was involved in global surgery research for a lot of the early part of my career. At the moment, I'm very much intimately involved in the creation of life science companies. So if you would imagine the healthcare system as a system of pillars that, a good outcome rests on, I'm very much involved in the development, the conceptualization of new medicines, as well as their development in animal studies, taking those into human clinical trials, and then the commercialization of those assets. So along that continuum, I am actually very much at the start. So I create life science companies, I conceptualize medical drugs, create them and take them forward. And where I've managed to position myself is, I work with some of the best people in the world at this. And it just so happens that a lot of them are in Boston, so which brings me here. And that ties in very well with global surgery, right? Because a major center for defining the narrative and the story around global surgery outside of Africa has actually been in Boston. So you ask a question of how can we tell this story to the world? And for me, really, there's three pillars to this. One is, I think we really need to understand our audience. And sometimes as storytellers, we're so enraptured by the story we want to tell people. We forget about them, right? And how they're going to receive the story, what's happening in their lives. The next thing that I want to touch on is collaboration. And really, the final thing that I want to talk about is really how we actually define that narrative and tell people. So let's look at the audience. 2023 has been a really tough year for people. I think globally, there was the COVID pandemic, and now, we thought we were coming out of it. And it's been a year of massive conflict, both in Europe, the largest conflict ever seen in the world since World War II. And now we see conflict in the Middle East, right? And so I think where people are right now is a lot of people need hope. Now, there's an opportunity there to tell stories about, things that make a big difference in people's lives. It would be remiss of me not to mention that if you look at the Time Person of the Year, it's Taylor Swift. And, the important thing there is that's a great storyteller, but it's a message of hope, right? And that's what people are looking for this year. I think as we go forward, we need to understand that when we ask people for investment, this is a really tough time economically across the world. So people want measurable outcomes. They want clear, definitive plans, even if it's for the long term, right? People are not worried about that. It's more that they really don't have time to look at a lot of ideas. So what they look at has to be very well baked. So let me go on to the point of who we pick as stakeholders in our audience. I think we have to pick, if I could actually just make it very simple, I'd say there's a lot of Africans who are in the diaspora who have levers of power to either open both financing, skills, or collaborations with pretty large institutions who are trying to find ways to interact with Africa, but are really struggling to find those points of communication. I want to say that you, Salome, and the late Professor Bongani Mayosi were very clear points in which, if I wanted to say, how do I help Africa? I'd say, this is where I need to go. And I want to commend you on your leadership on this front because, sitting on the other side, it's actually difficult to find clear stakeholders who you can trust, who have integrity to go to. So that's the other challenge is we need to find African diaspora healthcare workers who are buttressing the healthcare systems of other countries. And also, I think, looking at private healthcare institutions. So part of solving challenges in Africa is going to be a mix of government investment, which is required, but also private healthcare systems. And I think, part of the aversion that we have training in our medical schools is that, we look at private institutions as bad things. But the truth is they're actually providing a service that sometimes the state cannot provide, both in terms of very niche areas or the cost of providing that healthcare on a public healthcare basis. So I think engaging the right actors who are aligned with our values and objectives to help and come and fill in some of those spaces or to co-invest is absolutely critical. Without private financing, I don't understand how this is going to work. So I think we have to be open to that. And finally, I think where we can meet governments where they are. So for instance, solving healthcare in South Africa is like whack-a-mole. How are we going to solve that if we know that the healthcare system in Zambia, Zimbabwe, Mozambique is not working, right? And, it's not lost on me that actually these borders, they're just constructs. People have families across different places. If you need healthcare, people go and find it where they can. So I think there actually has to be a multi-state effort to at least ensure that we have basic healthcare infrastructure across the region. Otherwise, it's just not going to work. I know it sounds gargantuan, but we have to look at it this way. So on the point of collaboration, I think that really covers it is these kind of investments, like a UCT Global Surgery Unit, having a reciprocal unit in Botswana, Kenya, across the world, your ASOS trials actually help bring everyone to the table. Because when we tell our story, people ask themselves the following questions. Number one, which is, how easy can I just find one person who can help me to speak to everyone? I don't want to deal with thousands of emails. Can I speak to one group that actually has a lot of influence, that gives me a sense of the accurate picture and can actually cause change continent-wide? So I think these collaborations that you're making are the way forward. And I think engaging our global stakeholders, having good structures, accountability that's visible, good governance, measurable outcomes is critical. And I think that's incumbent on African storytellers to make sure that they're doing it from a position of strength, having built structures so that once you start a conversation, you actually can't stop it now. And then when the other person says, I want to help, how can I help? How can I assist? Then they want to see a plan and they want to see how it's done. So you have to have that accountability, good governance, clear structures, measurable outcomes set out before you go tell the story. And finally, really, on that point, in order to think about how stories are told, we just need to be honest, right? So we can't ask people for platforms. We can't ask people for an opportunity to tell our story. We just need to tell our story. So if it's the annual UN meeting for all countries, we're discussing healthcare, we need to be there. If it's the Bill and Melinda Gates major fundraiser, thanking all their staff and projects for things that they're doing, we need to have a stakeholder in the room. If something happens where we have the European Commission deciding to do something on Africa, we need to have a representative there. So the work is on us to make sure that we penetrate these platforms, we tell our story, but we're not asking to be there. We're taking control. And, Bruce, just one thing, when people are listening about stories to do with Africa, I just want to tackle this straightforward. And I realize that I'm just one person. I'm not speaking for anyone. Big questions result are there's issues of corruption and good governance. So we can't fix major problems in Africa before we have people of integrity and we support people of integrity and we put structures around them to do this. So that's really, really important. All of this will fail if we cannot demonstrate as part of our storytelling that we have professional organizations with integrity and good governance. Because actually, we can present the slides, the plans, but really what's going on there is people are trying to say, okay, if I get involved, am I going to get burnt? And is this going to be sustainable?
Thanks, Tinashe. You raise a lot of points. I think the ones that I would like to really highlight is these countries in Africa are not silos. And I think you made that point really clear. And I think, yes, this is a continental effort that we all need to be working on. You've also touched on financing health, which we haven't discussed in these podcast episodes, but there's a big section in the book on financing health, which I think is quite exciting, and I would encourage people to read it. And it also does deal with this very important concept of corruption and accountability, because certainly we need responsible management of money if we want to be able to succeed. I'm going to now go back to Salome. So Salome, this is really about, I know you're a tremendous advocate for safe surgery in Africa, and you really have worked a lot with governments. And I think my real question is, what do you believe are the factors that contribute to governments being actively involved in improving healthcare delivery, and especially in resource environments where, outcomes are often poor? And I know from my own personal experience, and I think yours too, is that Ethiopia, for example, really stands out. They're actively involved in data science, quality improvement initiatives to improve health for all. Maybe if you can have a short comment on that and getting governments involved.
So I think I'll follow on partly where Tinashe left off, because how we tell our stories to our governments is extremely important. And, the one mistake you can make is to go to them with, this is what we think you should do as surgeons, and that we disregard every other thing that you've done. Governments, just like us, are looking at how can they provide better healthcare to communities, to populations, and at programmatic level. They're not necessarily looking at facility by facility, but they are looking at across huge populations. How can we make healthcare safer, including surgery? Surgery is not something that is outside, but you need to understand where our governments are and what each government is struggling with at the time. And so I'm part of organizations, or I attend meetings that are looking at, regional meetings across the continent, what's going on, what are the public health issues right now. Africa is still dealing with electricity and water issues, connectivity issues, and sometimes to bring to them perhaps somewhat of an accusation that you haven't prioritized surgery when there is no water in some of our healthcare facilities. There is a huge mismatch there between, yes, this is something that we rightfully need, but these are basic things that they are not even able to provide. And so it's important that we also constantly take a step back to understand what is the health system, how is our health system, what are the priorities right now, where is the focus, and what are the entry points, right? So I like to take an approach where when we work with governments or ministries of health, we have to understand each one individually. It's not let's roll out a cesarean section plan across the continent. It's what is the current status of access to cesarean sections in this country? What are the barriers? What areas are there to strengthen the system? And when you do that, you'll find that your program looks different across each system. Whereas in one, for example, the programs that we have, one is dealing with safer anesthesia for medical officers. In another province in South Africa, we are looking at safer cesarean sections because those are the areas of need that they've highlighted and felt we could help them in that regard. In another country in Africa, they are looking at the biggest need is scaling up the number of surgeons. So how can we support them in training surgeons, particularly subspecialists at subspecialist level, in a country where they don't have the surgeons to train the current surgeons, So when you start looking at it by province or by government, you will find that your interventions change and you have to tailor them specifically to that group that you're working with at the time. And I find that they are receptive once they realize that you are there to support them versus you are there with a prescription of what they need to do. But the other important thing is they require data. And I think as academics, that's one important area that we can strengthen, because often they don't know how bad the surgical outcomes really are. They don't have the indicators of some of the things that we are looking at, or even the actual targets of what the health workforce should look like. And so it's important that we don't take for granted that data is important to help them understand where the needs are and to give them a target of what we can work on together. But ultimately, it has to be a partnership. It cannot be we are leading this. It has to be a partnership where let us support with strengthening the surgical system and let us understand what their needs are. And together, let's co-create a plan that is going to assist the population at hand.
Thank you, Salome. I'm now going to move to Tinashe again. So Tinashe, as an entrepreneur and an innovator, there's a huge opportunity to do things differently in Africa, and particularly in a more sustainable manner. I think Salome, has touched on some of the problems, water and electricity, for example. This is a real opportunity for sustainable green healthcare system to provide health for the population in Africa. What would you consider attractive to innovators with this sort of opportunity?
Oh, you've touched on a topic that makes me really excited, Bruce. Let me tell you this. You might find it surprising that when I look back at periods where I was probably able to do the most with the least friction, it's probably when I was in Africa. Try and send money in the United States to someone else, and it takes 3 days. Someone was standing right next to you to send it to them. Whereas, in Africa, actually, when it comes to banking, with exceptional regulation, you can literally exchange through an airtime platform. You can send money to someone instantly, right? So what am I getting to there? I think there's a lot of rooms for innovation in Africa at relative low cost. I think the key thing is understanding the problems. So I think for innovators who are willing to dedicate themselves to work with practitioners, with stakeholders in government, public health officials to really understand what the problems are, I think there's a lot of great room. So for instance, I'll give you an example of a wonderful physician who I trained with at UCT, who you might know, Dr. Vuyani Mhlomi. The problem that he's looking at is our hospitals are full, right? And we need to take care of people. Is it possible to prevent people from going into hospitals by providing them the care they need before they get admitted? Is it possible, and we all know these patients, to discharge patients at the appropriate time, knowing that they have adequate home care support, that if anything goes wrong, we can find them again? We keep many of these patients within our healthcare facilities, partly because we can't answer that last question, which is what happens to them when we discharge them. So, by providing pretty high-tech facilities at low cost in someone's home that can monitor that patient's well-being and provide real-time data to either practitioners who can see that data or health professionals who can refer those patients in continually, it's great. So I think from that perspective, number one is I think for innovators to spend time with those in the healthcare system to really understand the problems. And the problems that I see standing here are, number one, financing for healthcare. So if you've got a good idea, where do you go to get it started? And here's the challenge. I think while there is private venture capital and a lot more healthcare grants in the global north, those kind of structures are not available in the global south to the same extent, but they're still there. So, I think key for those who want to innovate is to look at things that are available. So, if I look at things like the Bill and Melinda Gates Foundation, I think there's opportunities to do things there. But I think even just saying, what if I started a business that helped people to go and collect their medicines with motorcycles, right? And they can use what they have, 1 or 2G cell phones to order their medicines or to get healthcare messages. I think keeping things at a low cost where you can trial things in your community is a good idea. But again, I think interact with healthcare regulators and practitioners in your space. The other clear space that I can see is paying for healthcare. So outside of those who are accessing the government healthcare system, we have wonderful providers of healthcare. I won't name the big private healthcare institutions that we all know, but these institutions really have a monopoly over the market. But if we look at that issue that I described, which is how do I pay someone who's standing right next to me? Perhaps there's a way for innovative structures for people to pay for good healthcare in facilities that are close to them. And, it all hedges on the internet, our cell phones. And that's what I would say is if I were situated where you are now, I would be thinking about how to integrate technology, payments, and access to healthcare in my home. So I think this is an exciting time. And, we have great healthcare workers in Africa who can use these tools. We're seeing how it's working in India as well as in China. It just surprises me that those things haven't happened yet, but I have no doubt that they will. And one final thing, I can't emphasize this thing about good governance, transparency, and integrity. And I want to give the example of a famous technology entrepreneur who is also invested in healthcare in Africa. So Dr. Salome Maswime, he started one of the largest telecommunications businesses in Africa, but he started in Zimbabwe. And the issue that I want to highlight is no matter how good your idea is, no matter how long you work for it, if there is lack of transparency around regulation, around the rules, around financing, nothing will get off the ground. And it also hampers efforts that we have, right, within the state system. And innovators aren't just people who work, let's say, in the private sphere. We have innovators within the government sphere. And I think the same things apply, which is what can we do within our hospitals, within our departments? So I'm not even talking at a department level or federal or government. I'm saying even within our hospitals, can we get innovators together and talk about the problems in our facilities, and with the freedom to operate that we have at that level and the allocation of resources that we can allocate at that level, what can we do to band together to improve the number of surgeries that are done, to make sure that our theaters are clean, and also to make sure that we have good outcomes that are coming out. So, I'll leave it to you to define that, but you can see that you can operate in the private sphere and you can also operate right where you are to innovate if we come together.
Thanks, Tinashe. Wow, I could chat with the two of you for hours. We've already gone over our time. So unfortunately, I'm going to have to bring this to a close. I've just got one more question, and could I ask you just for a short answer if you do want to answer. It's really to both of you. Is there a question that I should have asked you that I haven't asked and you would like to address?
It's not a question from my side, but I really like what Tinashe was saying. And because the question is, how do you strengthen the health system? We've spoken about really practical measures that we have developed in global surgery, and many of them taking what we've learned from public health. But Tinashe has also spoken about innovation, and I spoke about leadership earlier. And so we teach both in the business school and in the School of Public Health, and of course in the surgical departments. But yeah, I think it's a comment just to say there are so many interesting pathways to strengthening the health system, and we have to think outside of the box.
In fact, Bruce, not so much a question here, but an idea. So, I happen to work at the largest hospital complex, probably in the global north. It's the Texas Medical Center. Just to give you, it's a city. If it were its own city in the United States, it would be the 8th largest city, $35 billion of GDP that happens there. We're talking about 35,000 healthcare workers, all within the area of, that would be half the size of Manhattan, right? So this is a huge economic and healthcare beast. They see 10 million patients a year. This organization has partnerships with countries such as the UK, Ireland, Australia, right? So that any innovators who are in their countries who want to collaborate with innovators in the United States, so they need an office, they need access to customers or partnerships that they want to create, they can come to Houston, right? And they are essentially incubated in that building, and they can build their business in the United States or do technology transfer, skills transfer there. Wouldn't it be great if we could translate some of the ideas we've talked about today and, bring Africa to the global north. So what I'm saying is, imagine if there was a bilateral summit where it's not about people from the global north expounding on these problems. And also then they come to Africa and they still want to expound on the problems. But what if there was a conference, perhaps, in Cape Town where you had innovators and, people involved in policy, not talking about what the problems are, but actually showcasing what they're doing, right? And then what if we had a very similar format, right? And I'd offer it right here in the global north. And, Houston is a great place for that. And I think that would be great, is to bring innovators, policymakers to talk about healthcare, to talk about what you're doing, so that others who want to help can say, you know what, that's where I can fit in. And I think there's a great opportunity with that. And, if there's anyone who's listening to this podcast, perhaps you have ideas too, and I'd encourage you to contact Bruce and Salome. But I think we can build on this if you're open to it.
Thank you, Tinashe. I think that's a great place for us to finish today. Thank you both, Salome and Tinashe, for giving up your time to chat with me. You guys are great. You guys are leaders. Thanks for everything you've done for us. And then just to the listeners, there's one more episode after this one, and it was basically will sum up this series with Olivia. So thank you all, and good afternoon.